Welcome to the third World Health Summit in Berlin. What they had in mind was the same thing you will be doing here, namely discussing the results of medical research while also taking the social and political context into account.
I'm very impressed with the Health Summit. It's a very exciting time. The combination of bringing academic expertise together with public health policy, the interactions with World Health, with UNESCO, with political movements, I think in the long term is going to enable the rapid translation of new medical discoveries to many areas of the world.
Where climate change is very much linked to health, because when climate is changing as it is doing now, the environment is getting warmer, and even microorganisms that cause infection thrive in warm environment. So change of climate would in a way affect health in many ways.
Urbanization is a global phenomenon and is creating new health challenges.
Besides the governments, the civil society has to be aware that their own development, even in the rich countries, is very much dependent from the development of poorer countries in the world.
Well, the goal should be that the the developing countries do not suffer from walking through the same curve of evolution, but that they can rely on what has been achieved worldwide and go from there, not to repeat some mistakes of the past.
Global mental health is a very important issue. Mental health disorders are responsible for about 13 or 14% of the global disease burden, and they're extremely important, and they should be given a priority.
The number of things that governments and NGOs can be doing more of, first of all, is just to map and to understand which communities, which women and children are not receiving the interventions which are already in place.
It's a broad recognition in the world today that vaccines are some of the most efficient ways of bridging the gap. Vaccines are cost efficient. When we want to invest in health, investing in vaccines is something that almost guarantees us results.
Health is a universal value for everybody all around the world, and I think we have to do something for health. When we have the capacity to put billions of euros on the table to save the system, we can put few billion of euros for health.
So it's a very fruitful meeting because we need scientists of different disciplines, not only the hard science like biology, but also social science. And I think in future social science is extremely important in order to change behavior of people.
My key sentences is that the world should come together and speak with one voice.